Dr. Anderson from Anderson Podiatry Center for Neuropathy and Chronic Pain, here to talk to you about COVID vaccine and nerve pain, neuropathy type pain. And as a lot of you know that watch my YouTube videos, I do a lot of work for patients that have neuropathy and restless legs and chronic pain. And you can go to some of our other videos and learn more about what we do. But what I want to talk about is COVID vaccines and nerve pain. So I've been seeing this. I'm not seeing it a lot, but I am seeing that people that have had the vaccine can get nerve problems. And I think probably some of you have heard this in the news. But I'm trying to tell you it's real. And I recently had a patient, her name's Kim, and you can look up, we're putting more and more videos of her on YouTube, but I want to explain her story a little bit more detail. She's explained it, but I'm going to go through it, I guess maybe from a doctor's point of view. She came to me about several months ago, referred by her primary care doctor, throwing her arms up because she couldn't find anything for this lady to do. Kim's pretty strong. In other words, was beginning to wonder if there's something wrong with herself up here mentally. Like, is this real? Nobody seems to believe me. But there is a real problem with her because we are helping her gradually through the process, and we've been doing surgical procedures on her nerves to relieve pressure on her nerves. And I'll maybe get to that at the end of this video. But first of all, her history was simply this. About a year ago, which would be January of 2021, she got exposed to COVID, got COVID, hadn't been vaccinated. After that, had just a tiny bit of nerve issues in her lower extremity. Foot, mainly on the right, not left, but right foot and leg. Then in June of 2020, she had the first vaccine, got significantly worse nerve symptoms, way worse. Actually went ahead about a month or so later and got another vaccine, got worse even more. Very much the symptoms were correlated very strongly to her having the vaccine. Not so much from having COVID, but the vaccine. Saw multiple doctors, saw a neurologist. One of them I even spoke to one of the doctors, just thought that it was frankly, in a nice way, he said it's kind of up there. She's dramatizing, whatever, it's not real. So I saw her, evaluated her, and did surgeries to reduce pressure on nerve tunnels in her legs. First time in her legs. And then secondly, we just got done doing some surgeries more on nerves in her feet. Her presentation was a lot of burning, tingling, numbness, much like regular neuropathy symptoms on her right leg, and had a drop foot, hard time pulling her foot up into the side. And her pain was so severe that her toes were kind of constricted. She did not want to move them because they would hurt so much. Did first session of surgery on 3 nerve tunnels in her legs, got rid of most of her drop foot. She got quite a bit of her strength back, was able to pull her foot up into the side, like we all do normally. So regained a lot of strength and got rid of 90% of the pain in her legs. Took her back to surgery. This is probably about 2 or 3 months after the first session of surgery, and did some surgeries in her foot. One to open up the main nerve tunnel that goes bottom of the foot called the tarsal tunnel, and then opened up a nerve tunnel area in the inner space in her foot where there was what we call a neuroma, and then a little tiny nerve branch on the top of the foot called the deep peroneal nerve. So a lot of nerve procedures done. Patient's doing awesome. I just saw her today. So how does this happen? And I don't have all the answers. I'm not here to explain that. I'm just here to say we've helped her, and there are probably other people out there, and maybe I'm just reaching out to you to let you know, hey, this is real, and you need to be aware of it. And particularly in the process of getting boosters and stuff, man, be aware that she even got boosters. So be aware that this is real, and it could be from having had COVID vaccines. And I'm not here to dispute if they're good or bad or whatever. I'm not here to make a statement about that. I'm just here to make you more aware, make you think critically, and evaluate for yourself where this is all going. A lot of you probably been vaccinated, but I want you to know if you know other people, or maybe you considering you might be doing a booster and you've already have some nerve issues, you might want to think twice. So how could this be? How could somebody like myself do surgeries to reverse your neuropathy? And that gets back to the basics of what I've been doing now for, close to 20 years. We believe that when people have neuropathy, they have tight nerve tones. There's compression, there's tightness in the nerve tones, much like when you get carpal tunnel in the hands. It's no different in the lower extremity. The difference is most people aren't aware of that. You just are labeled as having neuropathy. There's nothing you can do. Live with it or take medication. And I'm trying to tell you, as a peripheral nerve surgeon, you need to have those legs examined, those feet examined very thoroughly by somebody specializing in peripheral nerve surgery to see if you qualify, see if maybe there's compression going on. So how would this have happened with her? It's a really good question. And I'm here to tell you that from my exam of Kim, she had tightness, she had compression in her nerve tones. Well, how did she get that? How did COVID play into this? Here's the idea, and listen closely, because I've seen this with people as an example that have had chemotherapy-induced neuropathy, okay? We've helped multiple people that had neuropathy because of their chemotherapy. Well, chemotherapy is toxic to your nerves, number one. Could it be that the vaccination is toxic to your nerves? Very possibly. Not sure the mechanism, but that's the idea, that's the theory. Okay, so if you've had the vaccine, let's say, somebody like my patient Kim may have had pre-existing tight nerve tunnels. What do I mean by that? Well, think of carpal tunnel. Before she had the vaccine, she already had some nerve tunnels that might have been a little bit tight, but they weren't causing any symptoms. The compression on the nerves were not causing any symptoms of burning or tingling, numbness. But what happened was, when she acquired the vaccine, it made her nerves toxic. Maybe her nerves were a little bit damaged from the vaccine. And because they're damaged, the compression that was pre-existing before the vaccine, the compression that was already there, made her nerves more sensitive to the compression because the compression was there, but the vaccine was not healthy to the nerves and made her more susceptible to the pre-existing compression. I think I don't want to explain it any more in different ways than that, but I think you get the basic idea. So believe me, it's real, and believe me that if you have these symptoms, if they're minor, it's a whole nother story. Maybe it'll gradually go away, maybe it'll get better. But please, if you're suffering from this in a severe way, consider that option. It's real that you have possibility of nerve damage from COVID vaccine. And the other message I'm trying to convey, hey, you know what? There's a way you might be able to solve this problem. So I hope that makes some sense. Very happy we could I could help her. Just saw her today, and I'm excited how well she's doing. Not to mention how excited she is. So anyway, if you like this kind of content, please consider subscribing to our YouTube channel. Please share this with other people out there that you may know that have a similar situation. And again, Kim's not the only one. I've seen other people, but she's probably one of the worst ones I've seen. Thank you for watching. And you might want to go to our YouTube channel and just type in Kim and COVID, and you'll find her stories. And we got one up there. We'll probably be getting a couple more up there as the weeks go by. Thank you for watching.